The long-term effects of COVID-19 infection have been found in people all over the world. And now, according to an analysis published in the medical journal The Lancet, COVID-19 could cause diabetes in people who are not even supposed to have the disease. The analysis by Washington-based scientist Ziyad Al Aly found that COVID-19 may work as an amplifier of baseline risks and an accelerant of disease development. We have learned in the past about how diabetics are more prone to getting infected with COVID-19 and are more likely to have more severe symptoms and complications. But now this revelation is indeed concerning. But the main question is, what is the reason behind this?
In different studies which have been reported from different countries, there have been sudden increase in the incidence of diabetes. Possibly it's the two mechanisms which may come to play is the increased inflammatory markers may affect the beta cell function. Adversely, the other is these inflammatory markers also increase the insulin resistance, the action of insulin becomes less. And this is the concurrent literature which we have which tells that there's been increase in risk of diabetes with COVID-19 infection.
Steroids have been counted as one of the factors as well. According to experts, some of the steroids are effective in curing moderate to severe cases of COVID-19, who might require oxygen or ventilator support. However, steroids can also increase the blood sugar level, and there's actually a term called steroid-induced diabetes. Experts suggest that many people who suffered from moderate COVID infection came back with a diabetes diagnosis, and the numbers are higher from the pre-COVID times. So, are you at risk?
So those patients who are in the 4th or 5th decade of life, who have pre-diabetes, who have underlying chronic systemic disorders, or who are on anti-inflammatory drugs, these patients are more at risk for developing diabetes.
So, what can be done to identify those patients who are likely to get diabetes after COVID infection? According to experts, vaccination is the best way to decrease the severity of the infection, and the other way is to identify these patients early.
Whenever you diagnose COVID-19, you have to look at the glucose, fasting and PP. Also give us an opportunity to do the A1C test, tells us whether there's a pre-existing diabetes or not. And this will certainly help in detecting these patients early so that they can be treated more aggressively in the initial stage.
The most important thing is to know how to prevent diabetes after COVID. Well, the solution is simple, and that is to maintain a healthy lifestyle and diet. If you are overweight, then aim to lose some weight, as obese people are more at risk of suffering from COVID and diabetes. Next, exercise daily for at least 30 minutes to remain fit. And lastly, go for regular health checkups to diagnose any condition early. Hope this video helped you with important information about COVID and diabetes. Stay tuned to Shosha for more COVID-related updates.